Welcome back, everybody. As we all know, unfortunately, during the winter months here in Utah, we get that inversion setting in and the pollution gets trapped and our air is not so great. So how does that impact people who have asthma? Dr. Shilling is here from LDS Hospital to tell us the reality of it all and what we can do to try to make things a little easier for us all to breathe. What's going on? Kind of talk about that correlation between asthma and the bad air.
Certainly. As everybody knows, we do get an inversion in Salt Lake and some of the other valleys here. And when that inversion comes, it traps these bad things called particulate matter. And those little particles get into the lungs. And that may affect very healthy people as well. But if you have asthma, it's a problem because it will tend to make things worse. And so the longer that inversion lasts and the longer those levels of particulates are high, the more likely as someone with asthma may end up in the emergency room, may have more symptoms like cough and wheezing, shortness of breath. And so it definitely has an impact. I will say it's somewhat variable. So some patients, or people, not patients, so have no problem. Others really, really suffer from it.
Well, I think it's so interesting because I was telling you during the break that my family, I have this chronic cough. My boys have been coughing, and I chalk it up to being a cold. Chalk it up to being cold and flu season. That's what their cough is. But now I'm realizing it's most likely asthma. How can you kind of tell the difference? When should people be figuring out that it is asthma instead of a cough?
Yeah, you know, it's true. Everybody gets coughs and colds, and those last a few weeks, maybe a month. But if it starts to go beyond 3 or 4 weeks, those symptoms persist. It's probably worth talking to your physician or practitioner about that, and just say, hey, you know, this has gone on for a long time. Is there something else happening? And they can take a look at that.
So if you do have asthma, if things do get worse when the inversion and the air quality is bad, what can you do to be a little proactive? Because unfortunately, we can't stay inside all day long. We've got to lead our normal life. So what can we do to be a little more proactive?
Well, a couple of things. One is, you can take a look at the Department of Environmental Quality website, find out if we're on a green day, an orange day, or red day. If it's red, you probably want to stay inside as much as possible. It does look like air is cleaner indoors, for the most part, at least in our schools. And you want to be careful about exercise. So I obviously want everybody to be out exercising as much as possible. But if it's a bad day, you probably should exercise indoors or maybe in the morning when there's less ozone, and pay attention to your symptoms. If you know that you get worse when the air is bad, do your best to stay out of it.
What about the masks? Yay or nay?
It may help, but I'm not totally convinced a mask is the answer. Probably what you could do to help more is perhaps drive less on those days, just like they're asking us to do, and sort of do your part to decrease air pollution. Obviously, no wood burning, that type of thing.
If someone's definitely going to go outside, you just can't stop them, what's your #1 advice for them?
Well, I think short exposure is not great, but it's better than long exposure, so just minimize the time out there.
Very good, very, very good, because unfortunately we have to go on with life, even if the air is nasty. Dr. Shilling here from LDS Hospital. Of course, all of his information you can find on our website.